For those of you who are regulars on our webinar, I think you pretty much know who we are, but we'll go ahead and do introductions anyways. My name is Stephanie East, and I am the CANS trainer with Portland State University.
And I'm Angela Leet with Oregon Health Authority, the new Health Systems Division, and part of my role is to expand CANS use across the state.
For those of you on the phone, would you mind introducing yourself and saying who you are and what agency you're with?
I will unmute them. We will unmute you now.
They don't do individual therapy, but what they do is that they have...
Hi, this is Sydney Nestor with Marin County.
Good morning, Sydney.
Good morning.
Good morning.
Yeah, it might actually be...
Good morning. This is
So might have a better, because it's...
Debbie Hawkinson, Sanity Care.
If you do have noise in the background, feel free to mute yourself. But I have just unmuted everyone that has logged in.
Anybody else on the call?
Someone's vacuuming. Monday vacuum day.
In the room with us, we have Sherry Simmons, right? Family Care.
Sherry from Family Care.
And Melissa.
Oh, and Melissa Marbury with Portland State. If you have any questions, feel free to ask them via just asking a question. You can also use the hand raise function if our presenters are speaking and you just want to say that you want to talk. Or you can also type in your questions through the questions box, and I will receive your questions and ask them for you. Okay.
All right, so kind of the general topic for today, we're just going to go through and do some updates around the CANS and what's kind of been going on over the past month, and hopefully we can get some dialogue about how the training has been going and any needs and concerns anybody has about anything from either the training perspective or the state perspective. So getting into that, I'm going to turn it over to Angela.
Okay, so really no updates from the last month, but in case anyone is on the call for the first time or just wants some review, the reason we're doing these monthly calls and we're starting to ramp up training across the state is that on January 1st, 2016, the CCOs will have in their contracts that they're to begin using CANS within wraparounds. And there's no reporting requirements attached to that. It's really about a progressive infusion of the use of CANS in our system. So we're beginning to, like I said, do trainings and meet with CCOs and their workforce around how that's going to look. And that's a soft startup date. January 1 is not when all CCOs need to be up and ready to go. It's just to say that in 2016, we're going to start working towards wraparound teams, child and family teams, using the CANS in their work for care planning. And some of you have heard that at the state level, we're working really hard to get the eCANS system. And that is an analytics and reporting service that Dr. Lyons and his group have created, which will allow us to remove other data systems from the state, really from state use, provider use, CCO use, and move to one data portal that will allow us to collect all this data. So not just the CANS, but also demographic data and level of care data, the things that CPRS and BERS are currently doing. So we're still working hard on that, and my hope is 2017 for that to start up.
And the CASI will officially be gone, won't it, as of January 1st?
Yep. CASI, the CCOs can choose to continue to use the CASI to determine level of care, but we really want to begin moving towards conversations around need and how we can creatively meet those needs in our system.
Does anybody have any questions for Angela or anything that's going on at the state? No. All right, moving forward, here's an update on the trainings that we have so far. So far, the Regents that have scheduled, IHN has their CANS 101 scheduled for December 8th. Tri-Counties has kind of a CANS for Supervisors hybrid scheduled for December 15th. And then Youth Move and OFSN also have a CANS 101 training scheduled specifically for them. So I'm really looking forward to that one, and I'm grateful that we have both youth and family involvement in this process. IHN has also been the first to schedule CANS 102, and they have that scheduled for February 18th and 19th, so that's really exciting stuff. Sydney, I'm going to kind of put you on the spot. We had the first CANS 101 training in Salem. So Sydney, I wanted to see if you had any feedback from any of the participants or any suggestions for the future or how that went for you and your staff.
Sure. Can you hear me okay?
Yeah.
Okay. I heard a little bit of feedback. I think it was a really long day. So, you know, just for what it's worth, that it is what it is, I suppose. But, I think that for the ones that it was new information that hadn't had exposure to CANS, probably of the, I can't remember how many people were there, probably about less than half had no exposure or had never used the CANS before. So for that group, I think it was a lot of information. For the group that had it before or maybe are currently certified, I realize that I should have asked for clarification, and probably maybe our staff who are already certified didn't need to attend. For them, it was, I mean, they're already certified and they're doing it on a regular basis, so in a different context. But so I'm not sure what your advice would have been about that, Stephanie, but I realize I should have asked about that.
I think the harder thing too is there were a couple in the room that do it for DHS, and there were some differences, and so I think that was kind of a struggle for those particular folks. You know, I think one of the care coordinators came up to us afterwards and said that he really liked the dialogue and the conversations around going through the ratings and stuff like that. But yeah, I think, you know, it's kind of beneficial for those folks who maybe haven't been certified or doing it consistently for a while, and for folks who haven't been exposed to it. But I mean, it is a lot of content. It really is, and I'm, you know, going to try to continue to revise the training so that it's, you know, a little bit more, I guess, engaging for those who participate. Because it is, I mean, it's the CANS. It's not super exciting, but I'm trying to make it more exciting. So.
Right. I mean, I know there's not a whole lot. I used to train on the CASI, and I always felt the same way. There's what you can do to make that exciting. But I think, I'm guessing other sites are the same way. Our care coordinators out when I guess you guys started with the test. So I got text messages from several of them about that, which I told them just relax. It's fine. No reason to worry. But, you know, and I would imagine that you guys could expect that, but maybe moving forward, if you didn't already give lots of reassurance around that, maybe
Even more.
something. I think when you have QMHA staff who are being told that this is a clinical tool, that especially county, maybe staff who don't work within a county structure wouldn't feel quite the same way, but within a county structure where the clinical hierarchy is set in a pretty specific way, that can be a little, I think that was a little stressful for them. But I think it was good information. They were interested in the content.
That's helpful. And for everybody on the call and here in the room, the CANS is not a clinical tool. It's also more commonly described by the Parade Foundation as an objective tool, and I think we can do some clarification around that lingo and making sure we're getting the right language out there. Family partners and youth partners can do this. Family members can be certified, so this is not a clinical tool. So we can do better in those areas.
Yeah, for sure. And for those who are on the call, you know, OFSN and Youth Move are also doing the CANS 101, and they're going to be involved in that process, and they're going to get certified as well. And it really, I mean, one of the things that we tried to talk about a little bit in training, and I think we need to emphasize it more, maybe actually get some of the data from that study, is typically the more degrees that you have, the harder it is for you to pass Rater certification. So youth and family partners statistically have a much higher passage rate than clinicians and QMHPs because that's just kind of how the tool is. You have to step out of your clinical self and stop looking at, like, why is this occurring, and look at specifically what is occurring. So I think kind of clarifying that and maybe getting some data from the study that was done in California around that would be really helpful, and maybe would set some of the care coordinators at ease, because some of them were coming up to us and was like, oh, this feels really clinical. It's like, it's not, it's okay, you know. It's just some of the items are designed to kind of capture certain things. But I appreciate the feedback, Cindy, and anything else that comes up as well. You know, I'm trying to tailor these trainings to the needs of the sites and the community, so I'm always going to be revising them and adding to them and making sure that they're reflective of what's working for people.
Cindy, just out of curiosity, and this is something I think wraparound programs need to speak to, but is a full day or 2 half days better logistically? Or is that something we should kind of offer up the choice on?
I'm going to guess that might be kind of a site-specific thing. Though, again, for staff who hadn't had any exposure to the CANS, I think it was a lot. So maybe for sites that that's the bulk of the staff, or that's all of the staff that are going through the training, maybe considering 2 partial days might be better. They were, I mean, they all just reported, again, the ones that this was new information, just really reported just feeling like it's a lot. So, sorry, I don't know if that's too vague.
No, and it's really helpful, and it definitely, I mean, it is a lot of content, you know, so trying to revise that in a better way. And then also, too, you know, there is the option to continue forward with some coaching around that if they're struggling with specific domains or if they feel like they need that additional support as this progresses. That's something that we can talk about as well.
Great. What we thought, what one of our clinical supervisors is going to offer, he has it set up for in a week or 2, is he's just for whoever's interested, you know, everyone's a kind of a different learner too, so for the people who are interested, he's going to be running through, going onto the website, the Parade website, and actually going through one of the practice tests and having them do it together so they can really dialogue about it. And I think for people, again, who are more like
right, moving forward. What we're trying to move forward with these calls and do with these calls is really move it towards being a support for CANS raters, and ultimately when the CANS 102 rolls out, being a support for rolling out CANS and wraparound. So what we're trying to do is really take feedback from the sites and speak to what works best for you guys. So that's kind of what we're trying to move towards. This is your opportunity to talk to PSU about training needs or scheduling or things like that. This is your opportunity to talk to Angela about any concerns you may have around the state or things like that. So we're really going to try to move towards that format. So please submit anything that you want to go over or anything content specific. Care coordinators are welcome to call in and talk about any concerns or questions they have or offer feedback on the training. That's what we're really trying to move towards, and I didn't have too much of an agenda today because that's what I would really like to see kind of going forward. The whole function I think that Angela and I really wanted to see from this is to really have an extra opportunity to provide that additional support to people. So please feel free to ask questions or take advantage of this time to get the needs of yourself and your sites and your staff met. Other than that, we're just going to kind of talk a little bit about the conference takeaways, and then we'll be done. Unless anybody has any questions, again, feel free to take advantage of this time. You know, we're here to kind of support you guys with this, and that's what we hope to do. But I know for me, one of the biggest takeaways of the conference, we recently attended the CANS conference in Seattle, hosted by Dr. Lyons, and one of the biggest things that I saw and appreciated from the conference was being actually able to see outcomes within eCANS and to see what that looks like. And it's, when it rolls out, I think it's going to be very beneficial. There's a tremendous amount of live data that's available and things that can be done within it. So it was really exciting to actually see what that looks like. I've heard it conceptualized and I've heard it talked about, but actually seeing it was really cool. So I think we're moving towards that. And it's exciting for me that we can have a tool that can access so much real time. And then Angela, I don't know if you want to talk about.
Yeah, another large part of what I do for the Oregon Health Authority is I'm the contact for anything related to commercial sex trafficking across the state, and I oversee the 12-bed residential program that Morrison's running. And so Dr. Lyons and the CANS conference offered a track that really discussed a lot of what the CANS is doing for that population, understanding that population. As we're all working to determine best practices, programs in California and other states are using the CANS to figure out if they're doing the right things and if what they're trying with that specific population is working. So we looked through quite a lot of data that the CANS was able to provide, and it's exciting. And there's a specific CANS version called the CANS ESE, and that is also available in Oregon. And when you go on to CANS training, you can get certified in that specific tool as well. And I'm continuing to look at that closer. I've been working with some of our CSEC providers who are giving great feedback on that tool and maybe some things we might want to change for Oregon. So I'll be curious what others start to see as they look at that tool. But if you are serving that population, that is available. And over time, we'll be looking at other modules and things that we can bring into Oregon that will help you deliver care to each of our populations.
I know there's been a lot of talk too about the developmental CANS. Is that something that we're going to be looking at going forward?
Yeah, there is a DD module available in the CANS Comprehensive. That's not the version that we're using in Oregon at this time. But when we have eCANS available, we'll be able to have access to each of those modules. And so if in wraparound you're providing care for a youth that's maybe multi-system, which really is what wraparound is meant to do, then those modules will be able to be pulled in. So we're working with the Parade Foundation on all those details. And again, any feedback or any specific needs you're seeing in your communities, I'd like to hear about it.
That's really all the content we have today, so I open up the floor. If anybody has any questions or anything that they want to discuss or any specific needs, we can go ahead and do that. But otherwise, that's really it for today. And then next month we'll start diving into the content a little bit more, and hopefully we'll have some more feedback from the sites in terms of what they need and what they want to go over.
Questions, feedback? Anything that these calls can provide that we're not doing at this time?
I have a question for Angela. This is Sydney again. Hi, sorry. Hopefully, sorry to be monopolizing.
You're not.
So I just wanted to confirm something that I thought I heard you say, Angela, when you were talking about just the contractual requirements, which I know are starting effective January 1st. But I had been wondering, is kind of the pace and the rollout of that, is that something that the sites can decide?
Absolutely. Yes.
Okay. That's kind of what I thought you said, but I just wanted to make sure. I haven't seen the contract language, so I didn't know if the contract said, you know, all kids in CAN starting January 1st, or excuse me, all kids in RAP have to have CAN starting January 1st or something like that.
Yeah, it's really not even that specific. So there's a one line item in there that says that CANs will be used within wraparound. And so there's not going to be anyone coming out on January 1st to see that every child and family team has done CANs for their use. So it's really just going to be like we've been doing with the wraparound expansion, just collaboration with the site leads, state site leads, PSU consultants. You know, so we'll just work it out for each region. Okay, great. Thank you. Karen Weiner has a question, so I'm going to unmute you. Karen? Hi, Karen.
Thank you. Okay. So my question is, and I'm getting some feedback here, so can you just hear my one voice?
We can hear you. We can hear you.
Okay. You had made comment about the CPRS database, and I guess my question to you, Angela, is when we have the ECANs, will we still be using the CPRS database?
No, the goal is that ECANs will replace CPRS.
Fabulous.
Yeah, we will not bring that in unless we can take CPRS out.
Good. Okay, thank you.
Yeah.
This is Chris Barnes. I'm a wraparound care coordinator in Baker County. And when the CPRS database goes out, will the BRRS go out with it?
Yep, that's the hope.
Okay.
If CPRS goes away, yes, BRRS will go with it. I wish I could say when this is all going to happen, but I'm working real hard and talking to all the right people and trying to get all the right approvals at the state level. But yes, we won't add anything else until CPRS can be taken out, and that would mean not using the BRRS tool.
Okay.
Like tomorrow? Did I hear you say Christmas? Just a red bow? Anybody else?
Well, thank you everybody for calling in. We really appreciate it, and hopefully next month we'll have more updates and maybe go into a little bit more content-specific stuff. But again, feel free to email us or contact us with any questions you may have, any feedback you may have. Care coordinators are welcome to call in as well when we start looking at content stuff and ask any questions they have around rating the CANs. We're here as a support for you, and this is going to be a continuing support moving forward. So. Thank you.